This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And in Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
Today we're interested specifically in sport-related injuries.
So you've been playing tennis for a long time.
Yeah, it's hurt.
What are the most common sports which are played over there?
Before you go to play, you have to strengthen your muscle.
Hello, coach.
Keep your thing and come here.
Hello, coach.
How are you?
Fine.
Good?
Yeah.
How's things today?
Yeah. Good.
Okay. We're gonna start first warm up, service line. Okay? And
Okay.
then we'll go to baseline. We'll make a rally, all right? Then we'll make warm up serve, and then we're gonna play games. Okay?
Okay.
We all agree that exercising and playing sports is absolutely essential to maintain good health and well-being. But sometimes accidents occur, and when they do, they lead to devastating consequences. I'm Dr. Khawla, and in this episode, we're going to talk about sports injuries and how you can prevent them.
Hi, doctor. How are you?
Hi, how are you, Fatma?
Alhamdulillah.
Have a seat.
Thank you, doctor.
Yes, just let me check, Fatma. So your name is Fatma, right?
Yes.
Yes, and what can I do for you?
Actually, doctor, my last tennis session, when I was turning my body, I feel some pain in my knee. And the second day, I feel like my knee is locked. And when I was walking, I feel myself like I will fall. So I don't know what is the problem, and I stopped my tennis session right now.
So you've been playing tennis for a long time.
Yes.
So you are a professional tennis player.
Yes.
Okay, that's good. That's good. So do you do exercise and everything, right?
Yes, I'm doing.
Okay. So you said you had a twisting knee injury.
Yes.
Is that-
I don't know if it is injury or no,
Okay.
but I feel some pain in it.
Did you feel a click?
Yes.
Okay. And the swelling got the same day or the next day you had the swelling?
The next day.
Okay, the next day.
Yeah.
Okay. Now, do you feel that when you walk sometimes you get like a locking session that you are not able to
Yes,
stand? or
actually,
flex?
this is what I felt the second day.
Okay, and do you feel like you're about to fall, like your knee gives away?
Yeah, this is exactly what I felt.
Which knee is it, left or right?
This knee.
Right knee. So it's a right knee.
Yeah.
Okay. Do you have any other problems? No?
No.
You don't have any.
No.
So how long have you been playing tennis now?
For 5 years.
5 years.
Yeah.
Oh, that's good. So you're at a professional level of playing tennis. Oh, that's good. That's good. Okay.
Thank you, doctor.
Do you have any other injuries?
No, I don't.
Nothing else. Do you
Nothing
have any
else.
other problems, medical problems?
No.
Okay. And how old are you?
28.
Okay, that's fine. So Can we examine? Is it okay to
Yeah, sure,
examine?
sure.
Can I see your knee, Fatma?
Yes,
Yeah,
sure.
just can you raise your leg? Okay, that's fine. Now, can you point where does it hurt the most?
It was here actually.
Okay, that's good. That's good. Okay, just lie down. Okay, relax. Okay.
Yeah, it's hurt.
Yeah, you have some swelling. It's okay. Okay. Can I just relax the knee? Okay. Does it hurt here?
Yeah.
at all? Yeah. Okay, that's fine. What about here? This is fine, right?
The pain actually is from here.
It's the main.
From
But
the
here
side.
it doesn't hurt you.
It's hurt, but not like here.
Okay. When I do that, does it hurt behind the patella?
Yes.
Below the patella? Does
Yeah.
it hurt? Okay. Okay. I'm just going to examine your knee. Okay. So I'll just examine your ligaments, and then I'm going to examine your meniscus. Okay. Just relax. Okay.
Do I have to be afraid?
No. Okay. Does it hurt?
Yes.
Okay. What about here? No. Okay. No. I'm just going to rotate your
Yes,
knee,
it's
and
hurt.
if it's going to lock on it. Okay. That hurts. Okay. Yeah, I can feel the click there.
Yeah.
Okay. Now, I'm going to examine your ACL ligament. Okay. So just tell me. Okay. Just relax over here. Okay. Relax. No, relax this muscle. Okay. Okay. This looks fine. Okay. From the examination, I can see that, okay, most probably we have what you call a meniscal injury, okay. Your ligaments are fine at the moment, okay. There is mild diffusion there, okay. What we will do is we need a special X-ray. We'll take a plain X-ray, but that will tell me only about the bones, okay. What you need is MRI, we call it MRI, okay. That's will tell me it's about the soft tissue inside more. It will tell me if there is meniscal tear or ACL ligament injury. So it's more specific for the soft tissue, okay.
So do you have to be afraid?
No, you don't have to be
I
afraid.
have to stop my tennis session right now or no?
Well, for the while, I mean, for the time being, you need to stop until we get what's the problem, okay. So if it's a meniscal tear, I don't want you to get worse, okay. It can propagate. The meniscal tear can increase in tear, so that will lead you into a complication, which we don't want it, okay. Or you can get locking of the knee while you're playing, and you can fall down and you can get injuries, some other injuries. Do you understand? After the meniscal, after the MRI, okay, we will tell you that you will need a procedure which is called arthroscopy, okay. You don't have to be afraid. It's a simple procedure. It's a day case procedure. Okay, what we do is we make two holes. One is over here and one over here, and we look at inside the knee. Okay, and that can tell us where the meniscal tear is, and we can either repair it by putting a suture there, or what we can do is we can excise it.
But after this, I can play normal.
Yeah, you should be able to play. It's what you need is after the scope, you need to strengthen your muscles, quads, all the quads around the knee, okay? And then you can play, should go back to normal within, let's say, depending on you, within 3 to 6 weeks, okay?
3 to
And
6 weeks.
3 to 6 weeks, you need to strengthen your muscles, and then you can go back. You should be going back to play tennis normally, okay? Is that fine? Okay,
Yeah.
so what we need now to do an MRI.
I have to go through the procedure now.
Yes, we have to go through the, which is a magnetic resonance. It's an ultrasound, so it doesn't have any radiation, so it will not affect on your what you call anything else, except that you don't have any metals in your body, right?
Yeah, no, I don't.
So you don't have any metals.
No.
That's fine. Okay.
Right now, I'm heading to the hospital to see if I can catch up with the doctor and also the patient.
Hello.
Hi.
Good morning,
Dr.
Dr. Salma.
How are you?
How are you? Have a
Thanks
seat.
for having
Fine.
us today.
Yes,
taking
it's
the
my
time.
pleasure to have you. over
Thank
here.
you. We were very interested to hear about Fatma's case, but before we get into it, can you talk to us a little bit about sport injuries? Where do they happen in our bodies?
Well, sports injuries can happen. Well, you know that the body consists of muscles, bones, ligaments, tendons, and joints and cartilages. Okay, so any one of these structures can get injured. Okay, and this is it's not only these. You can have head injuries, chest injuries, lung injuries. So there are. I mean, the whole body can get injured depending on what sports do you play.
Yeah, so sport injuries is not just a joint injury, right? They can occur anywhere.
It can occur anywhere, but most commonly we have the sports we have over here is like we play football and the basketball and the tennis. Okay, so most common injuries what we see in the clinic is the ankle and the knee joints. Okay, and these are the most common to what we see.
So can you talk to us a little bit about the knee injuries and what possible knee injuries can we get?
Okay, I just had a patient. Okay, we are lucky.
Fatma,
Okay,
right?
Yeah, Fatma.
Yes.
She was just here, and she's a professional tennis player. Okay, she got a knee injury, and I just sent her to an MRI, and I think we can see her in the MRI, and I'll tell you something a little bit about the MRI. Okay, most of the people they get afraid of MRI, doing an MRI.
I'm one of them.
Yes. Okay, so I will show you that it's a very easy, simple procedure. It tells us a lot about the knee, okay, or the soft tissue mainly. The plain X-rays which we do is it tells us mainly as on the bone, but there's an indirect way of something, but that's not very specific.
So can you walk us through the injury that Fatma has and which structures?
Fatma, okay, this is what you call a knee, okay, and we can see that these are the collateral ligaments. Okay, this is the medial collateral ligament over here, and this is the lateral collateral ligament. Okay, and you can see this is the ACL over inside. Okay, and there is the PCL, which is over here.
And these are also ligaments.
These are the inside intra-articular ligaments called. Okay, and then we have the meniscus, which is a crescent shape, two meniscus. Okay, medial and lateral meniscus. Okay.
What does the meniscus do?
The meniscus is it gives you it creates a more like a space for the condyles, femoral condyles to sit on. Okay, because you know that the tibial bone, which is over here, is more flat, and this will make it more like a round shape, so the femoral condyle can sit on them, and it gives the cushioning effect also. Okay, so and it gives that the condyles can move in a socket way, like a glide onto that. Okay, instead of going frictioning and that. Okay, and then we have a hyaline cartilage over the condyles. Okay, and this one also eases the friction between the two bones. Okay, and when this hyaline cartilage goes and the meniscus gets destroyed, okay, what you have we call as osteoarthritis of the knee. Okay,
Which is what a lot of people have.
well, yeah, which we see that in a lot of let's say about 50s and above. Okay, and these people, they get pain, and that's grading also. Starts with grade 1 to grade 4, and the grade 4 is the more severe one.
So what do you think Fatma has?
Okay, Fatma is what happened to her. She was playing tennis, and what she fixed her lower what you call foot on the ground, and then she twisted the femur. Okay, so the meniscus, which was inside, and there was a loading on the meniscus, and what happened is it got teared. Okay, so it's and it's depending on where is the tear and what type of the tear. Okay, and is it repairable or is it non-repairable?
Thank you, Dr. Adil, for today. I'm going to head now to physical therapy to find out more about how physical therapy can help with knee pains. Did you know that sport-related injuries result in over 2 million emergency room visits every single year? These visits can range from just a simple bruise all the way down to a severe head concussion. Now, one might be asking, which sport causes the most number of injuries? While the answer may be football or soccer in our region, basketball actually is the most sport that's likely to cause injuries around the world. Now, are these injuries preventable? And the answer is yes, absolutely, by using the protective equipment that are necessary and professional appropriate training. Today we're interested specifically in sport-related injury. If I'm someone who likes to exercise or play sports outdoors, what are the best practices to prevent injuries?
Actually, preventing injury, it's relating to how the coach training the players. So in my point of view, before you go to play, you have to strengthen your muscle. You have to have good muscles before you go to play football, for example. I can give examples here. Patients suffering from ACL or anterior cruciate ligaments tear, which is very common in sport. Most of those patients, they don't have the enough power for the quadriceps muscles, the front muscles of the knee. So it is very crucial and very important for the players to go to gym to strengthen their muscles before they go to play. And you know, each sport, it has different injuries. For example, we see most of the injuries comes from the football, which is the common sport in Arab country. We see the anterior cruciate ligaments, we see the ACL, we see ankle sprain. So I believe if the players go enough strengthening the muscles, the injury will reduce, but it will not prevent 100%, because it's still the player subject to injury.
So if I understand correctly, even if I'm a football player, practicing to play football is not the only thing I should focus on. I should also focus on strength training and making the muscles strong in a gym.
That's true. That's true.
When would you consider, that someone is overtraining themselves and they need to take a break, maybe?
Very good. That's actually you can evaluate the players. It is a matter of coach work. So, for example, you cannot take a lay person from the street and you put him immediately to the gym and you ask him to start strengthening his quadriceps and his hamstring and his back. Of course, he will get injury. So these questions, it's individual. So each players, the one involved in this area, he should evaluate his team and to set up the correct exercise for them.
Thank you for your time. This was very informative.
Good morning, Fatma. Hi, how are you? Are you okay today? Fine? Ready for the surgery?
Yes.
Do you have any questions?
No.
Okay. So in a while, just we'll go in, relax, okay? You won't feel, right? Try to raise up your, good? Yep, keep the thumbs up. I'll see you in the theater in a bit, okay? Yeah. Okay, sister, everything is fine? Shall we go? Yeah.
So Dr. Adil, walk us through the surgery.
Okay, that's good. Before I show you the abnormalities, I would like to show you what's the normal shape of the meniscus over here. Okay, so imagine this is the view which we take, and this is the femoral condyle on the top, and this is the tibial plateau on the down, and this is the normal part of the meniscus. You can see a very smooth meniscus, okay, over here, and this is the side. You can see it's a rough edge of the meniscus, okay, and degeneration has happened over here all over the white stuff, okay.
So the cushion really is no longer there.
Yes, the cushion is not there, okay, and it's not there, sometimes it gets rough, and the roughness of that cushion, which is the cartilage, it caused the rubbing between the femoral condyle and the tibial plateau.
So what is, I guess, the next step for Fatima right now?
The next step will be she will need some physio, which is strengthening of the muscles, okay, and then she needs to go to her sports which gradually, instead of just, she's not as before the injury, okay, so she needs to realize that she has to build up her fitness.
Thank you, Dr. Adil.
Common injuries, it depends on what are the most common sports which are played over here. For instance, in Bahrain, we play football is the most common sport, okay? So we see knee and ankle injuries, which are the most common.
So when I went to Dr. Adil, he informed me that everything will be okay. And I did the surgery, alhamdulillah. And everything is fine. Till now, I can see everything is fine. But it takes time until I go back to normal.
It's not just the athletes that get injured. Even a normal, non-athletic people, they get injured. And I consider the whole world as a playground, and the injuries are as not only to the athletes. There are non-athletic people who get injuries also.
Every week at Health Hub, we bring you the latest and most relevant information to your health. I'll see you next week. Stay safe.